Liposomal vitamin C and tianeptine withdrawal. A non-clinical overview based on personal research using AI. Do not rely on this document to withdraw from tianeptine. Share it with your physician and seek his or her guidance on what is best for you. How liposomal vitamin C helps reduce pain in tianeptine withdrawal. Liposomal vitamin C reduces pain during tianeptine withdrawal by boosting natural endorphins, protecting existing opioid peptides, and suppressing overactive neurotransmitter pathways. Because tianeptine acts as a full agonist at the mu-opioid receptors, its abrupt cessation triggers severe opioid-like withdrawal pain and hypersensitivity. High-dose vitamin C acts as a natural biochemical buffer to mitigate this physical distress. Mechanisms of action. Increases natural endorphin levels. Vitamin C is a required cofactor for the biosynthesis of neuropeptides. Supplementation directly supports the synthesis of endorphins and endomorphins, which are your body's natural pain-relieving chemicals. By raising endogenous endorphin levels, it helps bind to vacant mu-opioid receptors, naturally dampening the intense body aches and hyperalgesia caused by withdrawal. Inhibits opioid-degrading enzymes. Withdrawal places massive oxidative stress on the central nervous system, which rapidly degrades what little natural endorphins the body is producing. High concentrations of vitamin C act as a potent antioxidant that inhibits the endogenous metalloenzymes responsible for breaking down endorphins. This keeps your natural pain-killing peptides circulating in your system longer. Modulates glutamate and NMDA receptors. Opioid withdrawal causes a massive, toxic surge of glutamate, an excitatory neurotransmitter that causes muscle tension, restlessness, and a severe amplification of pain signals. Vitamin C acts as a modulator at the NMDA glutamate receptor complex. By inhibiting excessive glutamate activity, it calms the nervous system and prevents the hyperexcitability that manifests as deep physical pain. Reduces neuroinflammation. The sudden lack of tianeptine triggers an inflammatory cytokine response in the brain and spinal cord, which directly sensitizes pain pathways. Vitamin C dramatically reduces systemic inflammation and oxidative stress, calming the hyperreactive pain receptors throughout the muscles and joints. Why the liposomal form is crucial. Standard vitamin C, ascorbic acid, has low cellular bioavailability. Taking the massive doses required to alter neurochemistry orally usually causes severe gastric distress, cramping, and diarrhea. High bioavailability. Liposomal vitamin C wraps the nutrient in a phospholipid bilayer, allowing it to bypass standard cellular transport limits. Gastrointestinal comfort. It avoids the bowel tolerance threshold, preventing severe diarrhea in an already compromised GI tract. Blood-brain barrier. The lipid sphere merges more easily with cell membranes, delivering higher concentrations across the blood-brain barrier directly to the central nervous system. Fig. 1. Bioavailability comparison. Standard ascorbic acid. Liposomal vitamin C. Vitamin C, pain and opioid use disorder, PMC. Overall, vitamin C has proven a safe and effective adjunctive therapy for acute and chronic pain relief in various settings. Consider ascorbic acid, vitamin C, effects on withdrawal syndrome of heroin abusers. The study administered vitamin C orally in 2 groups of heroin addicts. Group A, 30 inpatients, supplemented with vitamin E. Vitamins and supplements for opioid use disorder. Your medical provider can give guidance on what is best for your situation. This information does not constitute medical advice or initiation timing and rationale. When should the patient begin a vitamin regimen as he prepares to detox, and why? For example, should he begin 2 weeks before quitting? Should he begin right after his final dose of tianeptine? Should he wait for 72 hours after quitting? Information regarding the timing of a liposomal vitamin C regimen for tianeptine withdrawal is provided for general knowledge, is not medical advice, and a healthcare provider should be consulted. Research on managing acute withdrawal symptoms from opioid-like substances often suggests that initiating high-dose, frequent liposomal vitamin C supplementation before the final dose, rather than waiting until withdrawal begins, is crucial. This approach, sometimes called a pre-loading phase, helps to maximize the potential benefits. Rationale for early initiation. Beginning the regimen 3 days before stopping tianeptine is generally recommended for several reasons. Cellular saturation. It takes time, often 48 to 72 hours, for tissues and the central nervous system to become fully saturated with the vitamin. Starting early ensures that the body has a sufficient, steady supply of the nutrient. Preventive support. Withdrawal involves oxidative stress and inflammation. Initiating the regimen beforehand allows for a protective buffer, which can assist the body when tianeptine levels drop. National Institutes of Health, NIH.gov. Gastrointestinal tolerance. Starting the protocol before the peak of acute withdrawal, which, for tianeptine, can occur within 24 to 48 hours, allows the digestive system to adapt, reducing the risk of severe stomach distress, which is a common symptom of withdrawal. Day -3. Initiate. Day 2. Saturation. Day 0. Final dose. Important considerations. Safety. The long-term safety of high-dose vitamin C is not fully established. Medical advice. It is crucial to discuss any supplement regimen with a healthcare professional to avoid potential interactions or adverse effects. Disclaimer. This information is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider for personalized medical guidance. This is for informational purposes only. For medical advice or diagnosis, withdrawal management, NCBI, NIH patients should drink at least 2 to 3 liters of water per day during withdrawal to replace fluids lost through perspiration and diarrhea. What is tianeptine? And are there recommendations for 5. 6. Tianeptine withdrawal symptoms and management. As mentioned above, recreational doses of tianeptine are typically much higher. Solstice H&W, Tianeptine Addiction Treatment in Sarasota FL, Mar 15, 2026, 3. Can I stop taking tianeptine on my own at home? Stopping tianeptine abruptly at home is not recommended. Withdrawal begins with risk analysis, 2-week preload. Q. If he begins his high-dose regimen 2 weeks before quitting tianeptine, will he end up negating the benefits he could have had if he waited? No. Starting a high-dose liposomal vitamin C regimen 2 weeks before quitting tianeptine will not negate the biochemical benefits of the vitamin, but it introduces significant, unnecessary health risks without adding any extra therapeutic value. The problem of diminishing returns. The human body has a strict threshold for vitamin C accumulation. Even with the advanced absorption of liposomal delivery, tissues, plasma, and the central nervous system become fully saturated within approximately 3 to 5 days. Extending the preloading phase to 14 days will not increase cellular levels any further. The excess vitamin C taken during those extra 9 to 11 days cannot be stored. It will simply be processed by the kidneys and excreted in the urine. Why a 2-week preload is counterproductive. Risk of rebound scurvy. When the body is subjected to massive doses of vitamin C for an extended period, it adapts by drastically accelerating its metabolism and excretion of the vitamin. If the patient abruptly stops or decreases the vitamin C dose right after detox, this hypermetabolism can cause a rapid crash in vitamin C levels, leading to temporary deficiency symptoms, rebound scurvy, precisely when the body needs antioxidant support most. Kidney strain. Processing megadoses of vitamin C for 2 full weeks increases the accumulation of oxalates. This elevates the risk of developing painful kidney stones or causing acute renal distress before the physical detox even begins. Severe gastrointestinal fatigue. While liposomal vitamin C is gentler on the stomach than standard ascorbic acid, maintaining extreme doses for 14 days can still wear down the digestive tract, causing mild irritation or loose stools. This leaves the gut compromised right before tianeptine withdrawal triggers its own severe gastrointestinal symptoms. The ideal timeline. To get 100% of the neurological and antioxidant benefits without the toxic backlog, historical clinical models for opioid-like withdrawal protocol advocate for starting the regimen exactly 3 days, 72 hours, prior to the final tianeptine dose. This time frame is the biological sweet spot to achieve maximum tissue saturation, safely prepare the NMDA receptors, and establish digestive tolerance right as detox begins. Conclusion. Frequent megadoses of vitamin C may help individuals with opioid use disorder, opioid addiction, comfortably reduce tapering strategy. Q. If his goal is not to quit tianeptine right away, but instead taper down, when should we begin inducing the vitamin C? If the patient is tapering down gradually, instead of quitting abruptly, he should begin taking vitamin C 3 days before his first scheduled dose reduction. He should then continue taking a dynamic, supportive dose throughout the entire duration of the taper, rather than waiting until the very end. Disclaimer: tapering tianeptine involves significant neurochemical shifts. This timeline is for educational purposes based on historical addiction protocols and must be supervised by a healthcare provider. The biological reason for this timing: a gradual taper still triggers withdrawal symptoms, it just spreads them out. Every time the tianeptine dose is lowered, mu-opioid receptor activation drops, which immediately causes microsurges of neuroinflammation and glutamate. Preloading the first drop. By starting vitamin C 3 days before the very first dose cut, the patient ensures his central nervous system is fully saturated with antioxidants and NMDA modulators before the brain experiences any chemical deficit. Preventing the catch-up trap. If he waits until a dose drop makes him feel sick to start the vitamin C, his cells will be depleted. He will then have to wait 3 to 5 days for the liposomal vitamin C to reach maximum tissue concentration, leaving him unprotected during the hardest part of the drop.